morning, everyone. At Compass Group, we serve 3,000 hospitals across the world every single day. We are the world's leading provider of food as well as facility management services. Our purpose in India is to shape a happier, healthier, more sustainable world every single day. Compass Group Worldwide is a nearly $40 billion group. We exist in 33 countries. We serve 5.5 billion meals every year. We serve 96 of the top 100 companies in the world. And as I mentioned earlier, we serve 3,000 hospitals with 350 million meals served every single year. Compass Group India is a part of this group. We do 11 lakh meals every single day in over 800 locations across the country. We are 38,000 great people whom I'm really very, very proud of. And we serve a lot of hospitals in the country, a growing set of wonderful hospitals, more than 25 today, and we do more than 10 million meals every single year. What's happening in the healthcare landscape? Clearly, it's evolving, right? If you think about wellness and nutrition, today everybody's thinking about that. It's not necessarily only in tier 1 cities that we think about it this way. Across the country, whether you get to tier 2, tier 3, even villages, people are beginning to think about wellness and nutrition. Though I must say, unless the food is tasty, at least in India, it doesn't lead to repeats. It doesn't lead to habit forming. And I guess you would agree with that. Medical tourism in India is increasing. We should actually be proud of that in terms of what we've become over the years. The industry is estimated to be $6 billion. We get close to 500,000 medical tourists every year in India. Our doctors work harder than probably anywhere else in the world, definitely harder than the West. So 1 to 900 in India versus if you look at the US, my understanding is 1 to 350. So it's a different paradigm for doctors in India. There's FDI coming in. KKR is invested in India. Recently, they actually made a majority investment in Healthium. So a bunch of people investing in India, and the competition is actually intensifying. Healthcare has been a journey of continuous evolution in India. If you look at surgeries, just a decade back, we basically had, relatively more manual surgeries. If you look at today, AI and robotics are now driving surgeries and actually making an impact in surgical precision as well. Reports tell us that 30% of surgeries today are happening through robotics. And the healthcare infrastructure is evolving significantly. Early part of the century, it was about multi-specialty, super specialty hospitals coming up, telemedicine coming in. And today, it's about AI and robotics driving through data, predictive diagnostics to cure cancer, to cure heart diseases, to cure neurological conditions. Significant change and more is coming, which is good for the industry and good for patients and good for the growth of the industry as well. And the other thing which we all recognize, I don't know, probably half of you are wearing wearables today, but technology is shaping the healthcare industry in India. I mean, we had a full panel on that. Won't spend too much time, but 2 million wearables just a few years back being sold every year. To 2030, we expect 130 million wearables to be sold in 1 year, which will revolutionize patient care in India. But perhaps we may be missing something seminally important. Physicians in India, doctors in India, reports tell us, don't eat and drink, whether because of time or otherwise, well in hospitals, right? And that possibly impacts their energy levels, maybe even their efficiency. If you think about patients, should patients, while they're being healed back to great health, should they have great nutrition helping them get there? Should they enjoy their meals? Today, two-thirds of patients in India don't think this way. They think that hospital food is not satisfactory. Food touches every one of us every single day. Actually, especially in India, we are born, we grow up on dadis, mothers' food, and all of us at home, people believe that food can be a great healer for us. So it's a rich tradition in India. I wonder whether we should all think about creating a culinary revolution in the healthcare infrastructure in India and actually make it a partner in the healing process of patients. We definitely should think about nourishing the health of all stakeholders in hospitals, whether it's patients with personalized recovery, help through nutrition, whether it's doctors, which I spoke about, where they get sufficient energy to be able to deal with their really demanding schedules, whether it's visitors who get the comfort, they're stressed, or whether it's care providers. Should we think about comforting, uplifting food for them and nourishment for them as well? We think about this and we do this every single day. As I mentioned, we serve a very large number of hospitals across the world and a growing number of hospitals in India. We love what we do, and we think we do it reasonably well as well. We deliver tasty nutrition, and we provide truly meaningful choices to patients, as well as hospital staff, as well as doctors. We understand in depth their nutritional needs and serve against those, and we make it hassle-free. We make it accurate every single time, and we use, to the points being made earlier, we use technology to do that, and I'll come back to that a little bit later as well. For us, every bite counts. Food in a hospital environment is a healer for some and provides comfort and hope for others. So for us, providing great choices across the meals that we serve, we do that really well across the hospitals we serve, across the world and in India as well. Right food, delivered with the right nutrition, with great taste, to the right person, to the right patient, every single time, is what we do, and it's not easy. It's not easy, and it cannot be done unless you're operationally excellent, unless you actually have a genuine passion for service delivery. It can happen only then, and we do this. It's not easy, but we do this. As I said, we use technology, and we strive to get it right every single time. Now, I mentioned technology. I wonder whether technology can actually help. And a lot was spoken about this. I'm sure a lot has been spoken earlier as well about this. And I have something small for you. Can we get the voice sound?
In a hospital, every meal served is not just food. It's a part of someone's journey to recovery. But imagine crafting a 7-meal tailor-made plan daily for hundreds of patients. There is no scope of error when it comes to food. Introducing MediRest App automates the patient menu planning and diet ticket process in just a few clicks. The super intuitive patient meal planning has a menu suggestion based on patient's clinical and digestive state. The dietitian can add or remove a dish and change its serving quantity, provide special dietary remarks with just a tap. While MediRest App filters dishes from the menu that contains allergens based on patients' dietary conditions, averting extremely clinically sensitive situations for both the patient as well as for the hospital. The dietitian can even add the favorite dish of the patient or override the system recommendation, allowing the patient's mental and physical wellness. With the on-demand option, the dietitian can instantly plan a meal if the patient is hungry between 2 meal times. A critical element of MediRest App is allowing the dietitians to input NPO, prohibiting the dietitian to accidentally plan for the meal. In case they consumed it will lead to complicate the treatment process. Back in the kitchen, MediRest App is equally powerful, instantly generating diet slips for each patient with key individual details captured. This eliminates any scope of manual errors in the meals served to patients. It also helps the chefs to plan for the cyclic menu of the hospitals using nearly 5,000 recipes. With all the data available in one platform, the Consolidated Daily Reports by MediRest App enables seamless kitchen operations for the hospital. Compass MediRest App, a one-of-its-kind program, helps hospitals to truly prioritize the patient experience and wellness, and remain compliant to the regulatory needs for healthcare certificate accreditations towards its FANB services. MediRest App, performance with a heart.
This app very effectively does what I was talking about earlier. It helps clinical dietitians deliver the right nutrition at the right time to the right patient every single time. So in that sense, it's a great benefit. It's a wonderful support for us to be able to get it right each time, consistently and with simplicity. I think it's time really to think about elevating the healthcare dining experience, not just because it's a good to have, but because it can really help in the process of healing patients across the country. We need to have it catered to modern needs. Let's think about patients and let's think about delivering the best possible nutrition to them absolutely consistently so that it becomes part of their healing journey. As we believe in India, food is a great healer. For doctors, let's serve up tasty, in fact, great tasting nutrition to be able to keep up their energies and hopefully help or probably help in some levels in their efficiency as well. For medical staff, all of us know it's critical for them to be well nourished and happy in order to be able to serve patients well. And for visitors and care providers, comfort food, great tasting food, great nutrition can actually help uplift them as well. So truly a time to be able to think about this and revolutionize and elevate the healthcare dining experience in India. For all that I've been talking about, If you want to taste it, we have a counter outside, and there's some interesting things being served up. For me, my mouth waters as I look at this. For immunity, there's chicken stew, Calcutta style. There's sprouted moong and spinach chila with stuffed paneer bhuji served with ginger tomato chutney as a fast healer. And for recovery and comfort, we have hare lehsun wali panchkuti khichdi with safed makhan on top of that. And if this speech has left you in a place where you need a mood booster, then there's a gluten-free brownie with 70% dark chocolate as well. Do try it. I think you'll really enjoy it. If I could ask the Compass team in the room to stand up for a bit. Our purpose is to shape a happier, healthier, and sustainable world every single day. It rhymes so well with your respective missions. We're at your service, and we'd like to be able to work with you to be able to make India a more healthy place. Thank you so much for your patience. Thank you.